institutions as well. I would now request ma'am to please enlighten our audience.
Hello. Hi, good evening, everyone. I'm Dr. Divya. As Miss Rachel has very elaborately explained about anxiety and everything related with it, I will try to, pick up some points which are not the same. I'll try my best in doing that. So for us, it's very important to understand what is anxiety, what causes anxiety, and what are the signs and symptoms that, they cross a normal line where you have to actually start taking some kind of help either with a psychologist or with a mental health professional like a psychiatrist. So, what is anxiety? Anxiety is basically what happens is it's an unpleasant, a very vague apprehension that starts coming up, which is associated with a lot of autonomic symptoms, like the patient or the person starts feeling very restless, becomes starts sweating. There is palpitations associated with it. The person says that my heart is beating very fast. It's like it's racing. Then you can have tremblousness. Your hand starts trembling. You are not able to speak clearly. You don't understand what's happening around you. Sometimes you feel this lightness in your chest as if something might happen. So these are certain signs and symptoms that start associated with anxiety. Now, what happens is that, see, anxiety itself is a very vast, a very vast disorder. So, like as Miss Rachel very clearly said, that some kind of anxiety is very important for us. It pushes us to do something in our life. It makes us more confident. Like when you're giving your exam, or if you are having a presentation in the office, some kind of apprehension, some kind of feeling anxious or feeling restless is very common. It's something that your body reacts to a situation. But what happens when this restlessness, this anxiety is so much that you are not able to carry on your daily work? Like suppose if you have these intrusive thoughts, they keep coming up continuously. You have some kind of an habit in which you want to keep checking things again and again. But it comes to such an extent that you're not able to do the next task, or maybe even your daily tasks that you do. You have this fear of, if I go and talk in the public, or if I go and talk on the stage, what will people think about me? Let alone stage, if there's a small social gathering, you start avoiding that, thinking that, you become overcritical of yourself, thinking, what will people think about me? Maybe they will not like me. Maybe I will not live up to their expectations. So what happens? You start avoiding these things. So this starts interfering with your everyday work. When you feel that either you or anybody else is started to suffering with these symptoms, where it is hampering their daily work, they're not able to do the normal tasks like they were doing every day, is the time when you should feel that, okay, something is wrong with me, something somewhere is not right. Anxiety, I'm anxious, I'm restless, it's okay. But now if it's interfering with my work, or if you see your spouse, you see your children, you see your co-workers, that this kind of anxiety or being apprehensive or trying to avoid things, making excuse, like in children, they start making excuses of not going to school. Now, why is the child making excuse every day? Like Miss Rachel said very clearly, that for children, they may not have these particular symptoms that are book related, that this is what the child might have. The child might have anxiety symptoms in a very different way. Like, let's say that, okay, a child is very scared when a dog barks. The child becomes very, starts crying, starts shouting. But it's not because that the child is scared of the dog. The child is scared because maybe, he or she has had a traumatic childhood or some traumatic incident in his life. Maybe there's some parent or some family member who really shouts in the house. So the child is correlating his fear, his anxiety with that of the dog barking. Similarly, what happens in anxiety is that, okay, in adolescents or teenagers, there's a lot of peer pressure that comes up. So they start acting it out. They start, becoming irritable. They start avoiding classes. They don't want to go to the school or even their colleges. Then what happens in adults? Adults also, we feel that we might not be having any kind of anxiety. It's very common for us. But sometimes this anxiety comes to a stage where you are not able to, even carry out simple meetings, like just talking to colleagues around you. You are not doing that. You start taking leaves from the offices. Sometimes what happens is that anxiety is so much that you don't want to even step out of your house. So this is the time where you should start answering or start thinking yourself, or for anyone else, that something is wrong. There is something that is bothering you or or the person around you, that these symptoms are not normal. So this is the time when you start taking some kind of help from a psychologist or a mental health professional. Now, these were some signs of symptoms which were in general. Now, anxiety is very vastly divided into a lot of different kind of disorders that happen. So picking up every disorder is difficult, but in general, there are a lot of disorders. And when you go to a mental health professional, the venue signs and symptoms that you tell them, that is the time when the mental health professional starts understanding what kind of disorder, what kind of anxiety you might be suffering from. You could be suffering from simple a panic disorder. You could be suffering from something as a generalized anxiety disorder, where you start thinking negative about everything. There is nothing positive around you. You feel like, everything is going wrong. And one thought leads to another thought. So it's a vicious cycle of negative thoughts that's coming up for every small thing in your life. Then there's certain people who come with, continuous, some kind of compulsive behavior or some kind of intrusive thoughts that are so much that they're not able to carry on with their work. Like, for example, if there is some kind of compulsive behavior that they have, so they are supposed to, like, let's say, count till 20. Till they don't count till 20, they will not take a next step. Or till they don't count till 20, they might not even, pick up a glass of water to drink. So these are small signs and symptoms that start coming up and start affecting their life. Then you have something like a social phobia, where you do not want to interact with people. You get very scared. You start sweating. You start becoming very restless. There are palpitations happening. There are tremors happening. So these are all, when you go to the mental health professional, they start, talking to you. They start figuring out what kind of signs are you showing, what kind of symptoms you are suffering from, and then they start figuring out what kind of disorder you might be suffering from. Now, why does this anxiety happen? There are a lot of studies that have been done, a lot of theories that have been put forward that why does anxiety happen? Why is that, we feel anxious, which is good. And when this happens, that this anxiety just crosses its line, when are the signs and symptoms start appearing? Why does this happen? See, first, what happens is a lot of hereditary factors that start coming up. Yes, we consider hereditary factors in general because if there is a family history of any kind of anxiety disorder, there are chances that, you might be suffering from or you might not be suffering from. Then what happens, in scientifically speaking, we have these neurochemicals in our brains. The three most common neurochemicals are GABA, that's serotonin, and even norepinephrine. Now, what happens is these neurochemicals are acting in your brain. Now, there is no particular reason that points out that, okay, this is a deficiency of this neurochemical, that's why you're having this disorder. No, it doesn't happen like that. In general, when there is an imbalance that starts happening in these neurotransmitters, you start showing signs and symptoms of various kinds of disorders. One of them is an anxiety disorder. So when there is an imbalance, these symptoms start occurring up. So what happens is that as in general population, what we feel is that, okay, if the person is suffering from an anxiety, the person is becoming restless, we start saying that, okay, get over with it. It doesn't matter. It's normal. But we have to understand here that if he's suffering from something like an anxiety disorder, it's not the person's fault. There is some kind of chemical imbalance that has happened because of any factor. Could be a traumatic childhood, could be any kind of incident that happened, could be hereditary, or could be idiopathic, that is without any cause, that he is having these symptoms. So rather than just telling them to get over with it, we should try to help them. Now what happens is that, okay, now this was something, I've told anxiety in, let's say, a big, vast, small bits and topics. Now, how do we treat anxiety effectively? Okay, Miss Rachel has taken care of the psychological counseling and everything very well. So when we start treating anxiety, we actually have psychotherapies to be done. And we also have pharmacological treatment. Now, what happens in pharmacological treatment is, yes, there are a lot of myths with it, which I will be discussing in due course of time. Now, what happens is that what happens in pharmacological treatment is that we have short-acting drugs and we have long-acting drugs. Now, depending upon what are your signs and symptoms, a mental health professional, a psychiatrist decides what kind of treatment you need. Do you actually need just a short-term therapy, a short-term medication which will help you overcome, or it is something which you might need for a longer run? Now, here I would like to, enlighten everyone here is that these pharmacotherapies do not cause any kind of harm to your body. They are not addictive. It's like when we are taking treatment for small illnesses, right? We have fever, we take medication. If we have chronic illnesses like we have diabetes, we have hypertension, we have thyroid, we take medications. Similarly, if we are suffering from any kind of a disorder, any kind of anxiety disorders, we are supposed to take treatment. And these treatments are very effective because anxiety is a curable disease. It is a curable disorder. So if the treatment is taken, there are chances that you will fully recover. But the treatment, the medications are always and should be taken according to your psychiatrist, how he or she prescribes you and in what way he prescribes you. Now, here there's one more thing I would like to bring into notice is that anxiety disorder can also co-occur with lot of medical conditions. Something like, there are studies that have been done, there are cases that have been studied. Thyroid abnormalities like hyperthyroidism is known to cause some or the other kind of anxiety disorders. Something like diabetes, hypertension is also related, and they also give out some kind of anxiety disorders. So do not neglect if you see any signs and symptoms which are not, which is something that is affecting your daily life. Now, yes, the difference between anxiety and depression is like, it's a very thin line. Anxiety and depression can co-occur. There are symptoms of anxiety that co-occur with depression. And there are very high chances that when we are anxious, we have anxiety. There are chances of depression, and it is vice versa also. You have depression, there are certain signs and symptoms which are same for both of them. We are feeling very anxious. We are feeling very restless. We are not able to sleep properly. Now, what happens is when we start talking to the patient, we realize that maybe those symptoms are not only anxiety symptoms. They can be depressive symptoms also, because it usually correlates with depression and anxiety. So it is very important for us to understand here that if there is any kind of problem, if there are any symptoms that are coming up, instead of just, ignoring them, or trying to just think that what will people think about me if I go to a therapist or if I go to a psychiatrist to take treatment, or if I take my spouse or if I take my co-worker, it is not the right thing to do. It is nothing like that. If you're helping someone who has a mental disorder, who has an anxiety disorder, take that step. Sit with them, go talk to them. Understand what is the problem, what is the problem because of which these symptoms are coming up. And at a certain time when you feel that while talking to them that yes, it is not something that, can just go away. Ask them, help them to take a professional help. Now, along with doing psychotherapies, along with doing, let's say, medications, there are certain things, that we make the patient understand. And everybody should understand is that there are certain anxieties that are not in our hand. There are certain situations that are not in our hand, which are bound to cause anxiety. The most common of them right now is the pandemic that we all suffered, and we are still in that pandemic. This was something that is not in our hand. We had a lot of anxiety. Everybody had around the globe. We were anxious. Everybody was scared. So instead of actually thinking that what will I do? How will I do? What will I manage in this pandemic? This thing is not in your hand. Whatever the situation is not in your hand. It will take its own course. So what we have to make us understand ourselves here is that it is not in my hand. It is something that I cannot control. So might as well just flow with it. Let's see what the next step brings. Let's see what the next step brings. But certain anxieties where you feel that, talking on a stage or meeting people around you is causing you a lot of anxiety. That is something which can be taken care of. So instead of always having a negative thought that why will it go? What will happen if I'm not able to talk? If I freeze on the stage? If I cannot talk in front of the people? If I'm not able to give my exams? Instead of thinking so much of negative, we should always start thinking positive. Give yourself one positive thought for a negative thought that starts coming in your mind. If you feel this, that, okay, I will freeze on the stage, but why will I freeze on your stage? You know your topic, you know your presentation. Similarly, in the exam, why will you black out? Say this to yourself that no, I will not. I have studied and I can manage it very well. If you start giving yourself these positive feedbacks, you start feeling much better. The anxiety level starts coming down. Another way to effectively manage anxiety is taking a break from that situation. If you feel there is any particular situation, or if you're studying for your exam, is causing you a lot of anxiety, you start feeling very scared. You become restless that I cannot study, or maybe I cannot work on this presentation right now. It does not matter. Leave it for some time. Nothing will happen if you take a break from your presentation while making your presentation or studying for it or studying for your exams. Nothing will happen if you take a break for 10 to 15 minutes. Get up from your place of work, from your workstation. Maybe if you are like working from home or you're studying for your exams, close your books, do something that you like. If you like to play an instrument, do that. If you like to maybe, go to the kitchen, make yourself some kind of a lemonade, or whatever you like to do, something you really enjoy. If you're in a house, you like to play with your pet, do that. You like to talk to your grandparents. Maybe if you're if you're in your office, you're not able to work at that time, just go and talk to your colleagues. So what happens is that particular time when you're feeling anxious, rather than spending your time, wasting your time on just being anxious and not able to find a situation, a solution to your problem, you get up, you take a break, and then with a fresh perspective, you come back to your problem. That is how what happens is that your anxiety level comes down. You've taken a break. You feel much better. You feel much refreshed, and you're able to tackle that problem with a healthy and a proper mind. Another thing what you can actually do is accept certain things that are not in your hand and do something that is in your hand. Do not always strive for being the best. Work for being the best, but accept if something happens, if there is a problem, I should have a plan B to solve that problem. That is very important when we are managing our anxiety. But when you feel that, okay, after doing all these things, I am still not able to manage my anxiety, or somebody around me is not able to manage the anxiety, it is, interfering with my daily life, with my daily routine, then yes, please take the help of a mental health professional. Go to a psychologist, go to a psychiatrist, take timely help. Help your family members, help your friends or your colleagues. It's your duty as an individual to destigmatize this mental health or any issues related with mental health. Because mental illnesses, mental disorders, like any other disorder, is curable if treatment is taken on time. So for us, it's very important to understand, the more we talk about it, you are having a problem, you are getting anxious, you are getting very scared, talk about it. Talk to your parents, talk to your friends, talk to your colleagues. The more you talk about it, you are directly or indirectly spreading more awareness about mental health. If you feel your colleague or maybe your neighbor who is suffering from anxiety issues, is having symptoms similar to maybe you had a couple of months or couple of years back and you took treatment for it, go tell them. Tell them that it is okay, that if you are having these symptoms, if you're feeling so anxious, if you're feeling so restless, it is affecting your work, go take some help. In fact, go with them. If you see your children, if they're having a behavioral problem, you feel their behavior is changing, they're avoiding school, they're having some of the other problems, they're becoming more irritable, speak to them, take out time for them. Try to figure out what is the problem, what is causing this behavioral change. Maybe it is some kind of an anxiety which they have faced in the school, or they are facing among their peer pressure or anywhere else. When you feel as a parent, as a friend, you're not able to help them, take them to a professional help. Take them to a mental health professional where they're able to get a proper help and proper treatment. Okay, my topic here is finished, but I think I have almost